Hi everyone, this is Neel Raithatha, consultant audiologist and director of Clearwax. Thank you for joining me in my latest video using the Waxscape. And here we have a patient who attended with bilateral blocked ears. For the last 6 to 7 years, they need to get their ears cleaned out every 3 to 4 months, and it was typically performed by ENT during an outpatient's appointment on the NHS, and that's because this patient can't undergo ear irrigation, which is the method of earwax removal that was typically performed in primary care, so at your doctor's surgery by the GP or the nurse. Although in most parts of the country in the UK, the majority of GP practices are no longer offering ear irrigation services. So for that reason, this patient was referred to the NHS and they would get their ears cleaned out on a regular basis. However, for the last couple of years, they've really struggled to get an appointment because of the current waiting list and backlog. So this patient was recommended to me by a family member, well, I think 2 family members actually. And there's differences in the consistency of wax in both ears. So this side is really dry, crusted. The surface of the wax resembles sandpaper, so it's quite abrasive. So I've just put some medical grade olive oil spray, and that will just soften the surface to allow me to get a better suction grip. They advised that they use some medical grade olive oil spray in both ears, but in their right ear, which you'll see in a moment, they additionally use some carbamide peroxide drops. So carbamide peroxide is an equal quantity of hydrogen peroxide and urea, and hydrogen peroxide is known to destroy and kill chromopores. So chromopores are cells that absorb light and provide colour. So in terms of skin, one of the chromopores is melanin. And for that reason, the lateral surface of the wax in their right ear was bleached. Initially, I thought they got an infection because it was extremely white. But as you went deeper, the wax was a lot darker. They do suffer from mild otitis externa in both ears, more so their right side, hence why they can't undergo ear irrigation. So just remove that plug there. We've got this plug which is a bit deeper, but there's a bit of this plug that's more lateral, so I'm going to just focus on that. Bottom right of screen, we're going to get a good suction grip here and lift that away. And I think there's just one more plug. Let's have a look. Yeah, it's going to dilate the ear canal. Just going to get that in focus, and we're going to slowly bring this out. So I think this is the piece that they found slightly uncomfortable as I was extracting because of the rough surface, so it was rubbing against the side of the ear canal. So it's a bit more tricky getting the suction grip on this piece because it was a bit deep, and that oil that I initially inserted, not all of it penetrated through, but managed to bring this out. So that's literally hanging outside of the ear. I'm just gonna give it a little wriggle so it comes away. I think that broke away from a larger piece there. So just to the right, you may have seen that was the first bend. You can see that flesh. And then we're going to re-enter. I think there's a bit of crusted skin at the base of the ear canal, so we're also going to remove that. But before I do, I'm going to visualize the eardrum. There we are, so that looks healthy enough. You see the light reflex there, about 7 o'clock. So it's just a bit of crusted skin at the bottom. Always try and remove as much of this as possible, because sometimes you can get epithelial hyperplasia, and underneath that, so it's basically an increased amount of keratin that's lining the ear canal. And sometimes underneath that, you may notice an ulceration and some exposed bone. So I always like to see if I can remove that to visualize underneath. So again, I'm going to dilate open the ear canal. So we are using the medium-sized specular. So this is your size 2 in terms of what we offer at Clearwax with the Waxscape. So we've got 4 sizes. Size 1 is a smaller specular, it's 3.5 millimeters in diameter. Size 2 is 4.25, so I use that the majority of the time. Size 3 and size 4 is 5 and 5.75 millimeters respectively. So this is their right ear. I've had to reduce the brightness because we're getting a lot of reflection. You could see that lateral wax and skin, it's got this bleached effect. It's quite white. And I suspect this is because they were using the carbon biperoxide drops, because once we've removed that, this is more deeper wax. It's more of a typical brownish orangey colour. But this ear was a lot more impacted, so I'm going to use a combination of an ear hook and the correct to remove this. This ear I think was also slightly narrower. So I'm trying to just tuck this plug of wax and skin underneath the superior canal, because it's just tucked away underneath that. There's a few hairs here as well that's matted against the wax and counter plug, which can make it a bit more difficult to get a suction grip. So once I remove this more lateral whitish wax and keratin, I will increase the brightness again. But if I increase the brightness too much at the moment, it's just going to get a reflection because of that. So I'm just going to the top of the ear canal, just remove some of this bleached wax and skin. I'm just trying to rock this and tease this through, but I can feel that it's trapped. And the reason why it's trapped is that this plug, you may not want to visualize it, but it extends all the way towards the eardrum. So when you try and remove a large plug of hardened, encrusted wax and skin, and it's not breaking away, it's sometimes difficult to navigate it around the curvature of the ear. Our ear canal are not straight cylindrical tubes. They're bendy, twisty. They have narrowings and widenings at different parts of the ear canal. And in some sections of the ear canal are a lot wider than the entrance, so it's difficult bringing it through a narrower orifice. So I'm just trying to find a better suction grip, so I've just gone a bit higher on this plug. You see it's quite dry there. And I think this is possibly where I used the ear hook, so I'm just stretching open up the ear. I'm just looking a bit deeper. I'm going to glide that in. I'm going to turn the hook now. I'm going to bring this through. So I did manage to get some out, but the surface was quite dry, but the core was quite soft. And just as you witness on the on screen, the hook just dissected it. So I'm just focusing a bit deeper. So I want to get this as deep in as possible, trying to get in behind the plug. But I do revert to the correct in a moment, which has got a greater surface area. The correct typically is used for softer wax, and this is quite firm on the surface. However, the correct that we manufacture, the right correct, we've got a straight version, an angle version. They're made out of high percentage of carbon fibre, which gives it great tensile strength and elasticity. So it was more than able to cope with this hardened adhered wax and skin. So I've advised the patient to use some acetic acid spray, particularly in this ear, because I think they have overused the drops. There's no active discharge in there. There's no edema or swelling, so I think they've used acetic acid spray before, as recommended by ENT. So it may not appear like it, but we have got quite a lot of wax out already. And at the end of the video, I've got a still image where you can see all the wax and skin that are extracted on a tissue. So it's quite hairy. This is where I used the correct. So I'm just going to get in and behind and leverage this out. And I am applying quite a lot of pressure as I'm bringing this forwards. And it's here at the entrance where it's a bit narrow that it tends to get stuck. But that's a sizable piece there. So I'm just going to re-enter, stretch open the first band on the left. I'm gliding into the side this time, and I'm trying to go in and behind. Slowly leverage this out. So in the distance, the eardrum, there is an opening now, so this patient's hearing was already significantly better. And I'm just going a bit deeper with the correct, but you do have to be careful with both the correct and the ear hook and the ear pick. If you penetrate this too deep into the base of the ear canal, you can quite easily lacerate and graze the floor of the ear canal. So again, I'm just going to the midsection of this, and as I'm bringing it forwards, I'm turning the correct left to right to navigate that second bend. She just got some wax that was stuck in the specular. And I might revert to microsuction in a moment, which you'll see. I think I do. But before I do, I'm going to get this very lateral, dense wax away. So I'm going underneath. This bit here was actually out of the ear now. It's just in the concha bowl, so it wasn't technically inside the ear, but I scooped it out earlier and it remained in the concha bowl. So when I say the concha bowl, if you look at your ear, the external ear, just in front of the entrance, you've got this bowl, and you've got a sub-region and a higher region there. The top bowl, section of the bowl, we call that the cymba concha, and the bigger bowl, we call it the cavum concha. So that's the patient's eardrum in the distance, but we're just going to mop some of this stuff around the ear. So there's a bit of erythemus, a bit of redness here. They have been rubbing the ear quite a lot as well, because, as you can imagine, it's quite itchy and irritable for them. So I'm just hovering over the floor of the ear canal. I've just come out, I'm going to stretch the ear open. I'm just going to the back. Just past the first bend, there's a bit of dead skin here. So just going to mop that away. And we're going to go to the floor of the ear canal, remove this adhered wax and skin. Then it's just a little bit on the floor again. I just want to mop that up just in case there's anything underneath. I think we got a bit of clarinetting here, so I did stop. I think there, so we just left that, but I'm satisfied there's nothing underneath that, because we did manage to lift a bit of it up and remove the majority of it, and it looks fine. So again, just that's the first bend. You can see this ear just a bit more damp. It's the ear that they use more drops in. Carbon biperoxide, so anything with hydrogen peroxide or sodium bicarbonate can macerate the skin and also break down some of the epithelial skin that lines the ear canal. So I'm just going to come back out, widen the ear again. I'm just going to take away that piece of skin anteriorly to the right, and then we're going to visualize the eardrum again. So we get that in focus. So that's the hammer bone. There's the light reflex. And then you're going to see a couple of still images. So this is more of a zoomed out. So this is from both ears. And then I'm just going to zoom in so you can see in a bit more detail. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.